As you think of the inconvenience of your life right now, spare a moment for those who are working in ERs all over the world. Dr. James Maskalyk is in the thick of this, treating patients at a big town down Toronto hospital. He's also an award winning author, most recently for Life on the Ground Floor Letters from the Edge of Emergency Medicine. And Dr. James Maskalyk joins us now via Skype from his home in Toronto. So nice to have you on the program again. How are you managing through all this, Dr. James?
Feeling on the edge of emergency medicine like it's kind of always been, but we're making it through.
I'll bet you are. Now, are you able to go in and do your thing these days, or what's the status?
Yeah, that's right. So we're on a different type of scheduling now. Pandemic scheduling means, I worked 4 shifts. My last shift was Sunday. I now have 8 off. And that means if we get infected, doing one of the critical procedures that sometimes accompanies this disease, and we start to get sick, we can swap those 8 days off with someone else and get the full time to recover, because our biggest fear here is really not in the disease itself, though no one wants it, obviously, but in, weakening the strength of the people on the front line, the ER doctors and nurses and the support staff that keep this place humming.
Indeed. How much of that are you seeing right now?
In terms of sickness among staff,
Yes.
only a couple. So it's surprising. We are obviously in close contact, but we feel pretty well protected, and we've been serious about this, and just through the sheer will of Torontonians and Ontarians and Canadians, through the sheer will of these, our fellow citizens to stay isolated. We've got a bit of we had a reprieve. We were able to train. We continue to train. We're able to coordinate, safe pathways in the hospital. So we're feeling safe and well supported right now, which is a nice thing to say, actually.
Good. We may have an impression of what we think emergency departments are like all over this province at the moment, and I don't know if it's accurate. So I'm glad you're here to tell us what it's really like. So, what is it like in the ER these days?
There's a point. We've been through this with SARS. Obviously, I've been through this in some ways working with MSF in different situations. But there's a point where when the masks go on, it really changes your feeling about the work that you do, because there is a whole story in nonverbal communication. And right now, when you can't see the patient's face, you can only see the eyes. You don't know if they understand the information you're delivering. You don't know if your colleague needs to chat because they look, stressed or sad. You can't tell if they're smiling. So there's this loss of exchange. So it does mean it becomes a bit more, it takes a difficult situation and makes it impersonal,
Hmm.
which is a bit of a challenge for us. So I would say that there's that a shift in, not a shift in determination. In fact, if anything, that has increased, but the adjective grim, not because of the disease necessarily, but because of what we're all wondering if we will face, is a part of our day to day. So it's serious. The jokes, if there are many, and there aren't as many as there often are, don't land so well. People are stressed. People are stressed.
Hmm. I do need to ask you, because I've just heard from other doctors about the status of your personal protective equipment, and you referred in that last answer to when you put the mask on. So tell us, do you have enough masks? Do you have enough surgical gloves? Do you have enough of what you need?
Yes, we do, and it all depends on how big this surge gets. We're starting to see the first few critical cases, come into our ERs and through there to our ICUs. And so depends really how well the self-isolation is being taken seriously, and how what it means for the community cases that are on our way to us. But right now we do. And I was on a call this morning and we're talking about just that. And I heard for the first time the most kind of heartening language, which was, we must make sure that if we have more than enough, that there is no hospital left with none.
Hmm.
And well, that makes obvious sense to you and me. Why would that be the case? That's not the typical behavior of hospitals. Everyone is kind of left to their own devices, and we communicate out of necessity here and there, maybe shuttling patients towards their, treating physician or something. But that type of networking it just reminds me of an immune system in a person's body, like the lymph nodes and the cells that they hold, just responding, throughout this country. And as we share information almost through the networks of, internet or telephone, like a bloodstream, how to respond, what is the best mask, how do we decontaminate them, what are the treatments that work, how do you isolate, do you swab, or do you take serum tests? Like, it's a remarkable feat that is being accomplished in the face of deep adversity.
Hmm. Now, we know emergency departments are busy places at the best of times, and these are not the best of times. So tell me, well, it's a two-part question here. Is it as busy as normal right now?
It is busier purely with this preparation that we're in. And, once you have a critical case that needs you to manage them with utmost safety to yourself and all the health providers, then you need more of them. You need more support staff, you need more cleaners, you need to be more careful with your protective equipment. You may have to change that a few times. So in those cases, they take up more time than we would otherwise. But in
Hmm.
terms of absolute numbers of ER cases are down. They're down.
Well,
Our traumas are down. Few people are falling off skateboards. I think we're even seeing, we're surely missing disease. And that's one of our biggest fears. We don't want people to sit at home with a heart attack. We don't
no,
want people to have a stroke and don't feel safe calling 911, though I'm sure that's happening. But I do also think that people are taking care of themselves and leaning on communities for health advice and health information, Telehealth Ontario, and actually becoming more informed as a population. So we're actually answering fewer and fewer non-urgent questions as well too. And so, I mean, as you can tell, I'm kind of seeing the good side of this sometimes, and that's certainly the bad side. But I do see that the absolute numbers are down.
yeah, I mean,
Will we
it
see a
stands to
surge for
reason that
people
there's
who
going to
are
be fewer car accidents coming through the door at the end of the day, right? Most people are not out driving anymore. But
exactly?
yeah, but I've also been told by doctors in the past that probably three-quarters of what comes through the door on a typical day at an emergency department is not urgent. It actually is not an emergency. And I guess I would assume the numbers of those kinds of things are down as well. Is that right?
Yeah, definitely. And I'll just counter a little bit with, well, to that patient, it is an emergency, and so
Hmm.
we spend a lot of the time answering questions and assuaging fear. And at this time in our country, there's a lot of that. There's a lot of fear. There's a lot of anxiety. I saw a paper, I think it was today, that came out in the Lancet, which is a journal you can trust, saying that the mortality rate is less than 1% from this disease. That's greater than the seasonal flu, but it's not, out of control. That said, people are terrified. Look at the tents going up in Central Park. People are wondering, is this like a movie that's going to come sweep into their homes and take away those people they love? And the answer is, probably not. Are we, responding to it as deftly with as much seriousness as we can? Definitely. So,
Hmm.
we are. You're right. I think more people are staying home, but maybe they're answering their questions themselves or turning to their community who can, help guide them.
Hmm. Tell me how because I presume part of the protocols here is to make sure that those whom you are treating who are positive with the COVID virus are in one place in the hospital, and then you got to keep everybody else away from them. How do
Mm.
you manage to do that?
Well, what we're trying to do is create a parallel pathway for people, as you identify, who don't have this febrile respiratory illness. And what that does, it means the people are more likely to come into the ER who need help. And there is an opportunity for us to work with that population of people without all the gowns on and things like that, because that does really stand in the way of us doing the medicine we want to do, the best
Hmm.
medicine. But there is there is this stage in this illness where people are infectious without feeling it exactly. So we treat ourselves. I wear what we call universal precautions, would be a mask and gloves. And so we're trying to take care of ourselves. And if there's any, worry of the patient, we separate them and obviously try to protect them as well too. So there there is this kind of trend towards treating all people like they're potential COVID cases, which is unfortunate, but I think the safest.
Now, let me just make sure I understand the protocols correctly, because I have been told that under normal circumstances, if a doctor is concerned that he or she is dealing with a patient with an infectious disease, it's one mask and one set of gloves per patient. And then when that patient leaves, that mask and gloves get disposed of, and a new mask and set of gloves gets put on for the next patient. A, if that is in fact the protocol. B, are you in fact still able to practice that now?
I would add a gown to that. If I think someone has a febrile respiratory illness, I want to protect myself, from head to toe, basically. I would even put a bonnet on, and think about my neck, especially if I think it's a COVID case. Certainly, what you need to change your gloves many times a day. And your mask, we're trying to be parsimonious with that. And the way that we do that is a lot of us are wearing a face shield. So the face shield prevents droplets from spreading onto you. It also prevents you from touching your face. So if you can keep your mask clean, maybe we're trying to make them last for two masks a day. That said, if you are in a possible COVID case, a serious COVID case, then I would change everything, because I can't risk contaminating my colleagues or any of my further patients. If it's low risk, then just those universal precautions you describe, and be fastidious about not touching your face, not touching your mask. If there's any question, there's no room for error. We err on the side of caution there.
Mm-hmm. I'm going to ask a very neutral, open-ended, lean question here. This is not a gotcha question. It's just,
okay.
But it is a political question.
Sure.
So here we go. How do you think the province of Ontario has responded to this crisis?
I like it. I like the consistency with the message. We changed swabbing criteria once, which muddies the data. For me, as someone who looks at it, I feel that made it difficult for us to know what the actual community burden was. So we're preparing for siege that we don't know the size of, but it's okay. But they've been consistent since. And I think that what's happening is you're seeing increasingly safe maneuvers. And if you counter that with what's happening in the most important thing here is a consistent message. People get inconsistent messages from, healthcare, or this, between Health Canada and throughout the province of Ontario. It means confusion. And in confusion creeps in inconsistency and anxiety. So I've liked what's happened so far. I think that, in the absence of martial law, there's been a consistent message to stay home, a consistent message that the attack rate of COVID-19, if a person sits at home with it in their room, is zero. So let's get this thing as close to zero as possible. And looking at the Toronto streets, people have bought it. So let's just hope that means that we're going to thread some kind of needle here. Most people who are my colleagues would say we're not. We've delayed it, but time will tell. Spring's on the way.
Well, I agree. When you look outside, there's certainly a lot fewer cars, a lot fewer people on the streets. There's no question about that. But I also saw the Premier of Ontario yesterday. Maybe saying explode is a bit too strong, but not by much. He was infuriated to find out that this past weekend there were still people outside enjoying the nice weather and not physically distancing themselves at all from one another. And he did say at one point, if I have to get tougher here and I have to take stronger measures in order to enforce what we've been saying, I will. Now, to use your words, that's not martial law. But it might be the Ontario Provincial Police running around and handing out $1,000 tickets to people who are going to act stupid. How much stupidity are you seeing out there that concerns you?
I noticed. I don't know if my sense is it could be the people who are recently returned, and I guess the possibilities are people who have yet to learn the rhythms of what we're all doing and are coming back into this situation from afar without the sense of what's the right word? Just the solidarity that we're all facing this together. So I think that with that type of announcement, hopefully people begin to be more careful, because I just touched my face. More careful. Yeah, trying not to do that, right?
It's hard not to. I know it's hard not to.
It is hard. It's so soothing. And I think that, yeah, even on Toronto street sidewalks, we have to space our walks. I think last weekend I saw the most people out that I've seen in a long time. And I get the necessity of a mental health break, but we're really in this, the next like 10 days. I've probably been saying the next 10 days for a month now, but
Hmm.
for the next 10 days, we're really going to see if we flatten the curve because we have these three spikes. One, the initial return travelers from early kind of mid-March, then
Mhm.
the spring break people who came back from we don't destinations unknown, and then this kind of like third potential kind of spring like resurgence of people on the streets. So if we can keep the numbers low, then we've accomplished something remarkable.
Hmm. James, I got a minute left, and I want to ask you this one last question because those of you who have either seen you on our program before or read your work or know of your work will know that you've been with Médecins Sans Frontières, you have done emergency medicine work in Ethiopia, you have seen some awfully desperate places around the world. How much did that help you prepare for what you have to deal with now with COVID-19?
I feel prepared, and it certainly told me that there has been epidemics like this one way or another all over the world, and now we all feel what it's like to have our own families at stake. And I wish no one early sickness or death. We stand in that way as heartily as possible. But I do hope that after this crisis is over, it helps us understand that there is work like this to be done of spreading that the goods of what we have, like from one hospital to another, even further than that, to places like Ethiopia or Sudan or Somalia, or who could benefit from the support from people far away who care.
Hmm. James, thanks for coming on to TVO tonight. And as they say, keep on keeping on, okay?
Okay, see ya. Thanks a lot.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.